will have several of these lap mentor machines, and what it does is it lets us learn and practice laparoscopic procedures in a virtual reality environment. So what it offers is some realistic anatomy to do surgical procedures, everything from removing gallbladders to colon surgery to gynecologic surgery, as well as practicing specific hand-eye coordination tasks and doing them repeatedly and actually being able to measure performance. It shows bleeding, it shows complications, it shows very, very realistic anatomy. The instruments, even though they're virtual, look realistic. There's actually what we call haptic feedback, where if your instrument touches something you don't want it to touch, you'll feel that, and that's also simulated. There are several different scenarios you can choose, different patients, if you will, and depending on what you do in that patient, the simulator will actually tell you you've had a complication, you've cut something you shouldn't have cut, your patient is bleeding, things like that. We generally use it with everyone from medical students to residents to practicing physicians. What we typically do is rotate them among this simulator, one or two other simulators, and then some very simple trainer boxes that actually have exercises they can do with instruments. The nice thing about the simulator compared to the trainer boxes is that it's reproducible and measurable, so you can actually measure performance on here. This is incredibly state-of-the-art technology, and it's one of the things that's helping us catch up with other industries. We're often compared to the airline industry, and how if you're a pilot of a 747, every 6 months you have to come in and prove your competence in the simulator. And in addition to proving your confidence, they throw complications at you. They'll have a wing fall off on the simulator and see how you recover and train you how to recover from that. That's where we're just starting to go in healthcare, and specifically in the surgical specialties. I just can't describe how great it's going to be when we walk in the door at Camel. It's just an amazing concept. It's going to be a one-of-the-kind facility in the country and even in the world, and it's really going to define the Tampa Bay area in healthcare.